Hello, my name is Dr. Diwan S. Raja. Today I will discuss about phenylketonuria. Phenylketonuria is a genetic disorder of defective metabolism of phenylalanine. The phenylalanine is an essential amino acid. Its metabolism is defective in PKU or phenylketonuria due to lack of an enzyme that is called phenylalanine hydroxylase. So this is a genetic disorder. Okay, and this is a single gene disorder. A single gene disorder. Okay, and the locus of the gene is 12q 24 1. Okay, so it is 12q 24 1. That is the location of the gene that is defective. There is defect in the metabolism of phenylalanine, so we'll get hyperphenylalanemia. Okay, so it is caused by mutation of genes that encodes the components of phenylalanine hydroxylase pathway, caused by mutation of genes that encode components of the phenylalanine hydroxylase pathway. Encode components of the phenylalanine hydroxylase pathway. Okay, so we get hyperphenylalanemia. It's intermediate metabolites due to lack of PAH, phenylalanine hydroxylase enzyme is missing. So in the absence of this enzyme, this will not be metabolized. So we got the phenylketonuria, the mechanism, causes of phenylketonuria. So what will happen? The phenylalanine and the metabolites of phenylalanine, metabolites of phenylalanine will go to the brain, will go to the cerebrospinal fluid, can cross the blood-brain barrier. Okay, crosses the blood-brain barrier. Okay, it depresses or decreases myelination, increases gliosis. Okay, So it increases gliosis, it causes, there will be low IQ, okay, and excessive phenylketonuria would be associated with congenital heart defect, congenital heart defect. And we know that phenylalanine is essential to produce tyrosine. So tyrosine is essential for melanin. Okay. So due to lack of melanin in the skin, okay, in the skin. That is another feature of phenylketonuria. So we got brain development disturbance due to lack of myelination, increased gliosis, low IQ, congenital heart defect, and certainly mental retardation. Okay, we got that. So these are the, and also there will be decrease protein synthesis in the brain, decrease protein synthesis in the brain. So there will be malfunction of the neurotransmitters, malfunction of the neurotransmitters in the brain, transmitters in the brain. So these are the problems associated with phenylketonuria. Okay, so if a lady is homozygous for PKU, if she is pregnant, then her baby will also develop the symptoms of phenylketonuria, irrespective of the baby's or the fetal genotype. Okay, so phenylketonuria, it affects infants. What will happen? It affects the fetus. It may cause intrauterine fetal death, uterine fetal death, congenital heart defect, okay, and also we found that as because lack of phenylalanine hydroxylase, there will be intermediate metabolite like phenylacetic acid, phenylpyruvate, phenylacetic acid, phenylpyruvate, phenylactic acid. They all can damage the brain along with the excessive phenylalanine. Okay, and this will give rise to mousy or musty odor of the urine and sweat gland. Okay, we got that. And the IQ is low, and a lot of the baby with phenylketonuria, initially they may be okay, but within few weeks they will develop the signs symptoms of phenylketonuria. If they are born, initial few weeks may be not a problem, then there will be buildup of phenylalanine excessive, and that may lead to low IQ plus milestone of development like, okay, about 1/3 cannot walk. Okay, so 1/3 of them cannot walk, and around 2/3 cannot talk. Okay, so that may happen, but there is a lot of mutation. The amount of phenylalanine hydroxylase and phenylalanine level may vary depending on the level of mutation. So presentation may be varied. So it may be benign presentation. During pregnancy, we may get intrauterine fetal death and congenital heart defect. We may call it gestational phenylketonuria, okay, or maternal phenylketonuria. So how to manage phenylketonuria? Management, restriction of phenylalanine rich food. Okay, what are the phenylalanine rich food? Like that turkey meat, okay, turkey meat, and tuna fish, all type of meat, including the breast milk, okay, even potato, broccoli, okay, broccoli. So a long list. Even some type of dessert like gelatin dessert may contain high level of phenylalanine. It should be restricted, but this is an essential amino acid. We cannot totally restrict the phenylalanine. There should be a balance between the amount of phenylalanine. Okay, so this is the way to manage the patient. We have other variety of phenylketonuria, other variety. Of PKU. So there may be defect in the tetrahydrobiopterin or BH4. So that may cause this work as a cofactor for hydroxygenation or hydrolyzation of the phenylalanine. These are the cofactor. So due to defect of that, we may have phenylketonuria. Okay, but we have some replacement therapy for that. Okay, or it may be a defect in the DHPR, dihydropterin reductase here, DHPR defect that may cause the defective formation of tyrosine and tryptophan, two other amino acid. So here not only the problem of the phenylalanine, but also there is some metabolic disturbance of the tyrosine and the tryptophan. Okay, so we have multiple variety of PKU, phenylketonuria, but this is the most common or classic form, around 97 to 98%. These are around 1 or 2%. So management is simple. Restriction of the phenylalanine rich diet throughout the life. So idea is that when a lady who is homozygous with phenylketonuria, if she is pregnant, then if she like to be pregnant, it is wise not to stop the phenylalanine diet. So it should be restricted before pregnancy, during pregnancy. Otherwise, irrespective of the genotype of the fetus will be affected due to phenylketonuria's signs and symptoms. Okay, so that's all about the PKU. If you like my video, please support my channel. Please subscribe me. Have a nice day. Bye now.